Good day, everyone, from wherever you're joining us. Good morning, good afternoon, good evening, and even in some places, maybe good night. We're back with Insights webinar. This is the 35th edition of the Insights webinar series, proudly hosted by eHealth Africa. And this platform brings together leading public health professionals to share knowledge, discuss critical issues, and explore innovative ways to strengthen healthcare delivery in Africa. My name is TJ Sojumu, and I'll be your moderator for today's exciting discussion. And once again, I want to welcome you for joining today's edition. Kindly share the link of this webinar to your friends, to colleagues who you know should be here because you believe this conversation is very important to them. Please share the link with them and remind them, let them join us as we go forward. All right, so just a quick background, right? Have you ever stopped to wonder just how safe the cooking oil in your kitchen is? In millions of Nigerian homes, edible oil is used every single day, but yet a large portion of what's consumed is unbranded, unfortified, and potentially unsafe. This silent crisis contributes to widespread micronutrient deficiencies, especially among women and children who are most at risk. And that's why the third-party advocacy for large-scale food fortification project exists. Now, this project is a joint initiative by eHealth Africa and CS with technical support from GAIN. And this project is driving a national advocacy campaign to phase out unbranded bulk oil. So in light of this edition of Insight Webinar provides a platform for us to raise awareness, share evidence, engage stakeholders, and chart practical steps forward in eliminating bulk oil circulation, while also promoting compliance and consumer education. And that brings us to today's theme, which I'm very excited about. Many of you must have seen it across social media platforms. Today's topic of discussion is safe edible oil for all, phasing out unbranded bulk edible oil for a healthier Nigeria. Once again, I warmly welcome you to Insights webinar. Don't keep this to yourself. Share the link and invite others to join this important conversation. Okay, so today's panelists are important partners who have led advocacy on food fortification and phasing out unbranded bulk edible oil for a healthier Nigeria. And I'm going to introduce them one after the other in no particular order. I'm going to introduce their portfolio and just read a brief bio that I have with me. And when I do that, I'll just, ask you to say hello to the audience. So when I call you and I read your bio, please just unmute your microphone and say hello to everyone that has joined us. Okay, so the first person I'd like to introduce is the Associate Manager, Food Security and Nutrition with eHealth Africa. His name is Mr. Dominic Gulak. He's an experienced development professional with over 8 years of experience in managing livelihood, food security, and nutrition programs. At eHealth Africa, he leads the TPAC project, advancing compliance with large-scale food fortification standards through data-driven advocacy, creative messaging, and real-time data analytics to influence policymakers, regulators, and industry stakeholders. His expertise spans agricultural value chain development, nutrition, and climate-smart agriculture, with a strong focus on strengthening community resilience and promoting nutrition-sensitive agriculture. He is a passionate advocate for healthier food systems. Mr. Dominic is dedicated to advancing nutrition security, promoting safe and fortified foods, and ensuring equitable access to quality nutrition for all. You're welcome, Mr. Dominic, and we're excited to have you. Can you say hello to the people watching online?
Yeah, hi everyone. It's nice to be here. Thank you very much, TJ.
All right, thank you very much, Mr. Dominic. The next person I'd like to introduce to us is the acting project manager, large-scale food fortification gain, in person of Adetola Otunla. Ms. Adetola Otunla is a public health nutritionist with extensive experience in food fortification, food systems, and stakeholder engagement. She currently serves as the acting project manager for large-scale food fortification at the Global Alliance for Improved Nutrition, GAIN Nigeria. At GAIN, she leads initiatives that aim to enhance regulatory compliance, strengthen governance systems, multi-sectoral coordination, and innovations within Nigeria's food fortification landscape to improve fortification compliance and strengthen monitoring systems. Since joining GAIN in 2022, Adetola has contributed to the design and delivery of impactful projects while working closely with government agencies, private sector partners, and civil society. She holds a master's degree in nutrition and dietetics and is passionate about advancing sustainable, systems-driven solutions to improve nutrition outcomes. We're glad to have you here, Ms. Adetola.
Hi, everyone. It's an honor being here, and I look forward to a great discussion. Thank you.
Thank you so much, Adetola. All right, last but not the least, definitely not the least, is the senior program officer and the TPAC project lead, but is the senior programming officer with Scaling Up Nutrition Civil Society Alliance, popularly known as CSSON, and is none other than Mr. Kunle Ishola. Mr. Kunle Ishola is a dedicated public health practitioner and certified project management professional with over a decade of experience in the development sector. He specializes in nutrition advocacy, budget tracking, project planning, and capacity building. And as a key member of the Scaling Up Nutrition Civil Society Alliance, CSON, in Nigeria, Kunle has played a vital role in expanding the CSON movement nationwide, driving strategic advocacy and multi-sectoral collaboration. He has delivered impactful capacity building workshops for CSOs across West and East Africa, and is known for developing actionable strategies aligned with organizational goals. With a strong background in working with government agencies and in diverse, fast-paced environments, Kunle is methodical, result-oriented, and proactive in his approach. He also mentors upcoming professionals as a consultant facilitator at the International Institute of Project and Safety Management in Abuja. We are glad to have you, Mr. Kunle.
Hi, everyone. Thank you so much. It's an honor being here. Thank you so much. Hope to have a productive discussion here.
All right. Thank you very much, Mr. Kunle. And if you're just joining us, I want to welcome you to the 35th edition of Insights webinar hosted by eHealth Africa. Today's conversation is going to be very, very interesting, very enlightening. And so I'd like you to just fasten your seatbelts. Don't go anywhere. Share this link, across your network and let people know that they should be a part of this conversation. Before we jump into the question and answer, we have a very short video clip, and we would like you to watch it as it will set the tone for the rest of our conversation. All right, so help desk, please. Help us with the video.
Food fortification is an essential tool in the fight against malnutrition. Food fortification is the addition of vitamins and minerals, also known as micronutrients, to widely consumed foods to increase their nutritional quality. Many foods can be fortified. For example, maize and wheat flour, dairy products, and rice, as well as cooking oil and condiments like salt and sugar. Food fortification is often treated like a footnote, with an asterisk. It doesn't draw a lot of attention to itself, but now is the time for food fortification to move to the title page. Food fortification has been around for over 100 years. Today, 160 countries implement national salt iodization programs, 90 countries mandate at least one kind of cereal grain fortification, and over 30 mandate the fortification of cooking oil, margarine, or ghee. Food fortification strengthens the immune system, helps to prevent sickness and death, and increases the productivity of people and nations. It can help to eliminate micronutrient deficiencies which cause many health problems, including rickets, birth defects, goiter, blindness, brain damage, and immune system failure. It combats the effect of climate change, as rising carbon dioxide levels make staples like wheat and rice less nutritious. Food fortification benefits people all over the world, rich and poor, rural and urban, in developing and developed countries. Fortified foods are not a substitute for a healthy diet, they are part of one. Over a third of the world's people cannot afford a diet that provides the nutrients required for a healthy life. Fortification is a low-cost way to improve the diets of large numbers of people. Very small amounts of vitamins and minerals are added, enough to provide a nutritional boost, but never so much that anyone has to be concerned about consuming too much. Fortified foods are intended to be consumed every day by all sorts of people. Fortified foods can be found in nearly every country around the world, but the journey to a fortified future is far from finished. Over 80 countries could benefit from new fortification programs. Most existing programs need to be strengthened to reach more people with more nutritious food. To get the job done, we will need to mandate, monitor, and mobilize. Everyone has a role to play. Governments can mandate fortification of widely consumed foods and condiments by food producers. Food producers and governments can monitor quality and compliance to enforce the mandate and ensure that fortified foods are available to everyone. Everyone can mobilize support for fortification. Development actors like the UN, international donors, non-government organizations, and academia can mobilize efforts to build technical know-how and capacity. Consumers and civil society can mobilize to hold governments and food producers accountable for their responsibilities. Food fortification is a no-regrets investment. It is affordable. It can reach billions of people. It complements other efforts to fight malnutrition. It requires no change to people's behavior. Every $1 invested in fortification generates $27 on average in economic return through increased health and productivity. Join the movement. www.futurefortified.org. Fortify the future.
All right. Thank you very much, Help Desk, for that video. And I'm sure that many of you are, quite a number of people might be hearing about food fortification for the first time. I know a lot of people are here, out of curiosity. A lot of people want to learn. A lot of people have ideas and they just want to find out what's really happening within the Nigerian space around this subject matter. And that is why I'm excited, because we have people who can really speak, to the topic that we'll be exploring today. And so I'd like to jump into the first question. So this topic is an exciting one. And my first question is for you, Mr. Dominic. Can you explain why anyone, should be interested in this topic? Anyone inside Nigeria, and, more importantly, the people watching you right now. Why should anyone be interested in this topic? Over to you, Mr. Dominic.
Thank you very much, Tijesu, and thank you for having the opportunity to start with this question. So when you look at Nigeria, I will try to talk more on the context here where we are. So you look at over time, there has been cases of deficiencies, especially with vitamin A, iron, zinc, and iodine. And over time, we've had cases of goiter before. Through iodization of salt, we're able to achieve great success. And we can confidently say within this space, it has been both a success story and as well as a work in progress. And this is because there are still gaps and more reason why the population need to be interested in a topic like this. So for example, which we'll also be making a lot of reference today on, is the National Food Consumption and Micronutrient Survey that was conducted in Nigeria. It was a national survey that has even bring out some of these gaps for us as a country. And currently, even the edible oil we're talking about, the data is already showing a large or a wide gap, because bulk of our oil in the market, for example, the survey is telling us about 69% oil in the market fails the Nigerian fortification standard. So these are not just numbers, these are not just statistics, but they are translation of a greater impact on our economy, maternal health risks, and even poor growth for a child. Data is also even showing that 1 out of 3 Nigerian child is deficient of vitamin A. So these are all areas I would like us to see and to put our interest, because it means a lot for us as a country. It's also a reflection of loss for us as an economy if this group of people we mentioned in the data are having such deficiency. Even for women, for example, data from the survey is also stressing the fact that about 82% of pregnant women in Nigeria, based on the survey, are deficient of iron. So these are all figures and numbers that we need to be interested in. And that is what the large-scale food fortification project is trying to do. So through awareness and advocacy, platform like this, we're trying to leverage on the Insight webinar to see how we can reach a larger audience. And just as the video you played mentioned, if you look at food fortification work, it is best done collaboratively. So everybody is a stakeholder. This is a public health even concern based on the data, and it should be a subject of interest for us all. So thank you, and over.
Thank you so much, Mr. Dominic, for really hitting the nail on the head. You know, I don't know if anyone heard him when he said a 2021 study in Nigeria found that 69% of the total volume of oil available to the population, and let me bring it home. You know, when we say to the population, it might look very far, available to us, was not fortified up to standard. It means that for even many people on this call right now, if we go to your kitchen or your store and we go and assess the oil that you have, there's a higher probability that the oil is not fortified up to standard, you know, and this really should give us a lot of concern. I'm hoping that as we dive into it, we'll have more clarity, and I'm looking forward to questions from everyone that is watching right now. All right, so the next question is going to go to Adetola. Dominic has spoken about, you know, the challenge around unbranded oil and, you know, oil not meeting fortification standard. Why does the persistence of unbranded bulk oil pose such a major risk to Nigeria's food fortification goals? But before you answer that, I would like you to first shed light on what food fortification is, for the sake of people who are just hearing that for the first time, who have heard about it lightly, but they don't really know much about it. So shed light on food fortification, then go ahead and explain to us, why does the persistence of unbranded bulk oil, why does it pose a major risk to Nigeria's food fortification goals? Over to you, Adetola.
Thank you, Sujesu. Yeah, large-scale food fortification, it's the process of adding micronutrients, essential micronutrients. And that's basically talking about your vitamins, your minerals, to your staple foods, that is your commonly consumed foods, right? The addition of these to your commonly consumed food, and the aim of this is basically to address the issue of micronutrients deficiencies. Large-scale food fortification program is basically done as a government program, but of course, like Dominic mentioned, everybody have their own roles. So the private sector is very, very important in large-scale food fortification. And this is because they do the processing, they do the work. So they have to actually follow the standards that have been set by the government. So this is being done, and we have the regulatory agencies that actually work to ensure compliance of the standards that have been set, to ensure that your edible oil, your sugar, your salt, your margarine is actually fortified according to the standards. And the check it along that system, right from the factory even to the market, then even to saying what are people really consuming itself. So that is a little bit about large-scale food fortification. And also to say more that I mentioned that it's locally stable foods, right? The majorly consumed foods. Now, this also is to show the effects of large-scale food fortification. It's population-based. It gets to everyone, no matter your economic status. So everybody consumes that well, almost everyone consumes that particular food product, right? So it means that when you are buying it, you are buying a fortified food product and you are beginning to get the benefits of that fortification itself. So now to bring this home to why the unbranded bulk oil is actually affecting the food fortification efforts. I'll basically say it undermines the food fortification effort. And the reason is because majority of the unbranded bulk edible oils, they are not really fortified. Some are not even fortified at all, right? Some they'll tell you, well, of course, to some level, right? And then by the time you look at it, let's even start by looking at the food safety concerns with this bulk unbranded edible oil. By the time you look at the way they are handled, the containers they are put in, so right from the point of distribution, storage, transport, even the way it's being handled, it basically creates an issue with food safety. So you basically look at this oil and you are not really sure what you're actually consuming itself, if it's actually even safe. Now, by the time we come to large-scale food fortification, I mentioned that these are actually the vitamins, the minerals are added to ensure that it combats, it fights micronutrient deficiencies. Now, imagine you're taking a particular edible oil that is actually not fortified. It means, well, the opposite of it, basically. That means that you are not getting that fortification like you need it to be. And there is also the issue around the traceability of fortification generally. So when you have bulk oil, you have loose oil, you have unbranded oil right there. When the regulatory agencies, they are supposed to be doing their own part of the work, when they go out to actually check for compliance, it is difficult to be able to trace back this particular type of edible oil. So it lacks the issue of traceability, and which all just ties back to the fact that it undermines the fortification effort. So fortification, like even the video has shown us, it has a lot of things that it brings to us. It has a lot of benefits. But then when we are beginning to cut corners, when things are not done according to how they should be done, then we go back to why we actually done it before, which is the high level of micronutrient deficiencies even in the country itself. For some of this bulk oil too, they are exposed to the issue of micronutrient loss. So for those that they will tell you that there is a bit of there's a bit of fortification done there. Look at the way they are handled already. You lose the micronutrients that is there. So it basically comes around to say that bulk of branded edible oil, it's a challenge that is definitely going to affect the efforts that every stakeholder had been doing around food fortification. When I say every stakeholder, not just government, I'm even talking about the producers themselves that are actually even doing the fortification itself. So because if some set of people are not doing it, some set of people are selling the bulk ones, now the efforts of everyone is becoming affected at that particular point. Yeah, over to you, TJC.
All right. Thank you so much, Adetola. I mean, something you said that, caught my attention is the fact that, food fortification is very important. And if we cut corners, it's going to affect, everyone, regardless of your class. Okay, so the next question I want to ask is for Kunle Ishola. Can you explain more? I know that because of the challenge of corners being cut, and that's why we have the third-party advocacy project. Can you explain more to the audience about this third-party advocacy and what is its relevance to strengthening effective food fortification in Nigeria? A lot of people don't know about the TPAC. Can you explain what it is?
Thank you so much, Jesu, for the question. And thanks to the other panelists on board for the discussion so far. So for the TPAC project, by the way, for history lovers and those who are music lovers, it is not TPAC, as some people will call it. It is TPAC, TPAC, Third Party Advocacy Campaign. So this campaign has come to bridge a gap. And from every discussion so far, it has come to bridge a gap which is designed to drive policy and public support for nutrition interventions in Nigeria. And this project has been implemented by a consortium of CSON and eHealth, and technically supported by GAIN, known as the Global Alliance for Improved Nutrition, GAIN. And so basically, this is leveraging the project, the TPAC itself is leveraging on strategic advocacy and multi-stakeholders engagement, to mobilize political will, amplify citizen voices, and foster partnership at national and state levels, basically. And there are two things that this project is looking at, the TPAC project. One, the promotion of large-scale food fortification, which is LSFF, and also the elimination of unbranded edible bulk oil, that should ring a bell, definitely, with our topic today, talking about safe oils and all that. So the project location for now is still within Abia, Lagos, and Kano states, but definitely it's a project that needs to be across the 36 states of the country, including the FCT. And our audiences are nutrition institutions, executives, legislators, community gatekeepers, the ones we know as either the traditional rulers or just leaders, basically. So why is it relevant? Definitely, whatever has come to bridge a gap is relevant, and that's why the TPAC is very, very much relevant to the discourse of today. The challenges we've had around talking about the unbranded edible oils, and we're talking about the weak compliance from the food producers, limited laboratory for testing capability and QAs, known as quality assurance, talking about the high cost of premixes, the mineral, vitamin, additive blends, and maybe the regulatory enforcement. These are some of the challenges that the TPAC has come to address, basically, and that's why it's relevant. And definitely, just like I said earlier, we are working with these multiple stakeholders to ensure that all of these challenges actually are breached and touched. So that is what TPAC is basically all about. Thank you.
All right, thank you, Mr. Kule, for passionately explaining to us what the TPAC, the Third Party Advocacy Campaign, is all about. If you're just joining us, I want to say thank you for tuning into this webinar, and you are in for an interesting conversation. We're talking about safe edible oil for all, phasing out of branded bulk edible oil for a healthier Nigeria. I can already see a few questions in the chat box. If you have questions, if you've had questions from when you saw the flyer, if you already have questions, please put your questions in the chat box and we will take your questions at the right time. All right, so thank you, Mr. Kunle. My next question goes to Mr. Dominic. Can you explain what role eHealth Africa is playing in this project and how, how that role informs and advances policy and advocacy effort with respect to TPAC?
Thank you very much, Tijesu. So just as Kule has mentioned, it's a consortium project, and basically eHealth Africa is focused on leveraging on data to see how data will be able to generate insights that will even influence our stakeholders on the project. So for example, on the TPAC project, we've used data as a central point, or I would say as our compass so far in the campaign. And basically, the role eHealth Africa has been able to play with data, or the role that data has helped us do so far on the project, or specifically to the project, is one, data has helped us identify gaps. So for example, like the reference I made earlier around the National Food Consumption and Micronutrient Survey, that was a national survey that was conducted. We try to use data through data analytics to be able to give insights to even what is happening. So for example, around gaps, the survey is already showing about 90% of households in Nigeria or more eat or consume edible oil. And out of this number, just 33% of this household consume branded edible oil. So that is a gap on its own. And it's not just a gap, but it then gives us an insight on how households are daily exposed to deficiencies, especially vitamin A deficiency, the targeted groups I've mentioned. Also, what eHealth has been able to do is to also use data in terms of tracking compliance. So, for example, if you look at the National Food Consumption and Micronutrient Survey, you would see that such data that was analyzed shows there's a gap even in terms of compliance. If we have only about 31%, sorry, of the oil in the market fortified, that means the remaining 69 or more of this oil are either unfortified or are even substandard. And that is what the larger part of the population are also consuming. So these are all gaps that are identified through data. And then also on the project, probably you also share with the audience, there's a LSFF, Large-Scale Fortification Compliance Dashboard, that was developed by eHealth Africa for the project, where you see this data in real time. So for example, even when you go to the dashboard, you try to pick states, maybe densely populated state, for example, like Kano, Kaduna, you see that data is already showing compliance as low as 30 to 35% for those states. So that is what eHealth has been able to do. And majorly on the project, we've tried to use data, for example, to even shape our communication strategy to stakeholders we are targeting on the project. For example, data was used to craft some of these messages for engagement with stakeholders at the national and then state level. Okay. Data was used to create a form of a factual conversation. Partners have engaged even with the policymaker at the state level. eHealth Africa has helped in crafting or developing those messages to be data-driven. So imagine speaking to stakeholders or policymakers, and then you're telling them it's just about 90%, it's just about 69% or 70% of the bulk oil in the market fails or does not meet Nigerian fortification standard. It resonates with them, and that is what eHealth Africa has been able to do. So largely on the TPAC project, I would say eHealth Africa has leveraged on data, and data has helped us to even get more insight to make the advocacy more credible, to also make our messages more compelling, and also the intervention itself targeted, because whatever we do is actually backed by data and not just vague appeal or based on emotion. So being utilizing data, or eHealth Africa working closely with the partners on data, it has really gone a long way in getting our audience attention as far as this topic is concerned. Thank you.
All right, thank you very much, Mr. Dominic. I can see questions are pouring in, and so Adetola and Kunle, I'm thinking I want us to move, maybe a bit faster so that we can take all of these questions because people really want to, know much more and get clarity to their questions and their thoughts. So, quickly for Adetola, what are the economic and social benefits of phasing out bulk oil for Nigeria in the long term?
All right, thank you. The benefits of phasing out bulk oil, it's basically the benefits of large-scale food fortification itself. So for edible bulk oil, basically the fortification there is the vitamin A. And you could typically just look at it that by the time every oil that is being consumed is adequately fortified according to standards, right? It typically means that, number one, it reduces the healthcare cost that comes from all those preventable illnesses that could actually come from the deficiencies of this micronutrients. So by the time you have the reduced healthcare costs, you are going to divert that cost into other things that is going to be of benefit to you, that could also increase the economic aspect of the country, right? There is also the increased productivity, your workforce productivity. Part of the benefits of vitamin A is improving your cognitive function. So imagine the deficiency of that, how that is going to affect your ability to have a productive workforce. And this goes beyond not just the individual productivity, you even look at it as an organization. So imagine you having a particular workforce that's basically their productivity is really bad because of micronutrients deficiency. Look at the economic cost that is really going to come to you also. So what I'm saying is that basically when this is done, when you have a well-fortified population, a well-fortified nation, it helps not just in terms of the health aspects, your public health aspects, it helps also in the economic aspects, It helps also in your workforce productivity aspect. And these are also part of the things that we need to look at. So I'm stating this because I know most of the time the conversation really focuses so much only on the public health aspects of things of fortification. And now this is just to spotlight also that beyond the public health aspect, which is obviously very, very important, there is also the economic and even the social aspects of these parts of large-scale food fortification, and invariably making sure that we phase out bulk unbranded edible oil and fortified. Thank you.
Thank you, Adetola. Thank you so much. Thank you very much. Yes, so it was great that you were able to take our attention away from just public, the public health impact, but looking at the economic and social impact of, unbranded bulk edible oil all over the Nigerian market. And so if it's phased out, it will have a significant impact, yes, on the workforce and our productivity. All right. So for Mr. Kunle, what role, you've spoken about the TPAC project, right? What role can stakeholders such as civil society, media, and communities, what role can they play in ensuring safe edible oil for all while ensuring effective food fortification? I know that there are people representing these groups, on this call. So what role do you think, these stakeholders can play in ensuring safe edible oil for all?
Yeah, thank you so much for the question, Jesu. Definitely the civil society, let me start with them. They are called stakeholders. All of these groups you've mentioned, they are called stakeholders. And the civil society organizations have a very important role to play. In fact, some people call CSOs watchdogs. And by referring to CSOs, I want us to not limit them to those who call themselves CSOs alone, but also faith-based organizations and CBOs called the community-based organizations. So they are the advocates, the watchdogs, as some people will call them. Some might call them mobilizers. And what they do, so you want to advocate for, push for strong enforcement of the edible oil fortification regulations. They are more like a bridge between the government and the people. What is not beneficial to the people, the unsafeness of these unbranded, unfortified oils by the people, by the consumers, and what the government should do, the CSO speed that gap. How can we bring the government to the people to the government to ensure that the right thing is being done? So, in other words, they also hold the government accountable for compliance. So, of course, we have regulatory bodies like the NAFDAC, the SON, the FCPC, as case may be. What is the level of monitoring with these government institutions? So the CSOs are there to ensure a follow-up, to make sure that they are accountable for the compliance that is ingrained in what they do. And also, if there's a possibility for, I was talking about the premixes the other time when I was speaking, and because of the high costs, it could be one of the reasons why we're having people go for these unbranded oils, because they're actually cheap in the market. But what if there's a tax waiver, for example, on a part of the production process, and which brings the price to be low for the common man to actually afford these branded and fortified oils. So these are one of the things the CSOs do. And very importantly, like you said earlier, majority are just getting to know more some things about fortification and even LSFF. So the CSOs are also there to sensitize the people in the community, even in faith, amongst the faith-based organizations too. But this is what it is, this is what it is not, this is unsafe, this is safe. More like a capacity building mechanism to them. And also to monitor, as I mentioned earlier, then I think the second stakeholder you mentioned is, if I'm not mistaken now,
Media.
is the media. Very important, very important. The role of the media in any facet of life cannot be overemphasized. And specifically with respect to these unsafe oils that are not branded, they are not fortified. The media have more like a bridge between the policy, the industry, that's the production, and also the consumers, which is the public itself. So we work with them to more for an improved public awareness, where we can get physically the wider reach of the media helps the information to go right. What is the myth around fortification and all of that? They help us to demystify those things. So that's one of the, and it goes across all media platforms, whether it is print, or the visual, as the case may be. Also, I know in the media space they call them watchdogs. So they help to put more like a pressure, that's what their term now, on the consumer themselves, and helps also with the BCC, what we call the behavior change communication. You know, these days you can imagine just having a WhatsApp message, this general message, and it goes round, and it's actually not giving people the right message on fortification, especially running from unsafe oils, goes a wider range. Definitely, they also support advocacy, even with them, as the case may be. For communities, this is very, very important. I think I saw somebody on the chat box asking the engagement about communities. Maybe this will answer the fellow. One of the things that the community does, and as we work with them, they also help us in demand creation, demand generation. How do I mean? If the demand for fortified oils from this community, from this citizenry is very high, the production will also be low, because the demand for it is high. Definitely the producing companies will down to the tune of the markets themselves. So at some point, definitely the communities also determine the production of the producers. They produce what the communities ask for more. So demand creation is very critical for the communities, and that's why the CSOs in their spaces, they need to go and enlighten them on the right choice. We call it informed decision. Informed decision. When they are properly informed, they can make the right decision to consume, to request and consume fortified, branded edible oils, as the case may be. And one of the things that also now mentioned, I think, is about the cultural acceptance, basically. So for all these three stakeholders, they are very important. Definitely, they work hand in hand. CSOs work hand in hand with the media, and also with the governments, and also the communities, because they are the grassroots. They are the grassroots. And for us that we are advocates, it is on this stick pack project, the third party advocacy campaign project. One that is very key for us is the community. It's the community down to the grassroots. We go up there. And while we're also talking about the policy space, looking at the nutrition policies that speak to this fortification, to large-scale food fortification, to the unsafeness of this the unbranded oils that we are talking about. So for us, it's more like a top-bottom approach, down from the community, then to the policy makers, to ensure that the right policies are put in place to support LSFF. So they are very, very important. Very, very important. Thank you so much.
Thank you, Mr. Kule. Thank you for that passionate submission. For everyone watching, you would agree that he's one passionate panelist, and we appreciate you for that. Okay, so we're going to jump into questions now, because I see it's 3:43. Time really flies fast. For every Insight webinar, we just always wish we have more time. So I'm going to jump into questions now. I think I have like a couple of questions. So the first question goes to Adetola, and maybe even the first two questions will go to you. So this question is from Elizabeth Adiswe. She's saying, how will an ordinary consumer know the oil we are buying is fortified with the requisite micronutrients? So Adetola, is that something you can answer quickly?
Sorry, do you want to take both questions so I could take them together? That's fine.
I think you can take this first, right. Then that one's a mouthful.
Okay, so how do you know if the oil you're buying is fortified? It's fortified adequately. So for edible oil, there is the fortification logo, which is the high logo. So when you're actually meant to actually put that high logo on your branded edible oil to show that your oil is actually fortified with vitamin A. But then to say also that the way food fortification is, and also looking at the fact that it is not every consumer that is educated enough to actually know that this is what you look out for and the likes. But if large-scale food fortification is done as how it should be done, right? The responsibility is not really on the consumer to start looking at it that this is fortified or this is not fortified, because you're not supposed to have a food that is not fortified as long as it is mandatory to be fortified in that country. So that means that I think I could use salt, which is one of our success story in Nigeria on fortification. Basically, you go to the market, you buy your salt, and you don't necessarily have to start looking out for it that if this is fortified or not. If it's done accurately, and the data actually shows us that the salt that is being sold in Nigeria is still heavily fortified, right? And which is because you don't go to market and ask for fortified salt. You go to market and ask for salt. And this is part of the idea of large-scale food fortification generally. Yeah.
All right. Thank you, Adetola. This question, I'll throw it to Kunle because he's spoken around this. So someone's asking, how is the project engaging the consumers of this unbranded oil? So can you just quickly, shed light on that? How is the project, the TPAC project, engaging consumers of this unbranded?
Yeah, thank you so much, Jesu, and the person who asked the question. Definitely, when the project started, one of the things we did is what we call the stakeholders analysis, to know who we're going to be speaking with, who are going to be engaging, how we're going to be managing them. And one of the highlighted stakeholders on the project are the consumers. So we've had on the project, the consultant has had engagement with the consumers across the 3 states of implementation at the moment. Really want to know what they are going through. Why did they have to consume what they consume? Why go for this and not for that? The level of their knowledge and all of that, which Dominic mentioned a little about data management and all of that. So we've actually engaged them. And one of the interesting things that we've even heard on the project is that they consume it because of poverty, financial issues, because most of these oils that are not branded, that are unfortified, they are cheaper in the market space. And that's why they do it. Most of them do not even know the accumulative negative effects of consuming these oils. It is from them we knew that some of the red oils we take are being, I don't want to use fortified, but that's not fortification. They add what we call colorings to some of these red oils, more like a feedback from them. Some of things we never knew. Some of the granite oils, from them too, also we know that some of these granite oils, because so as to increase the shelf life of these oils, some of these retailers who are also consumers tell us that they add engine oil to it. How can we have edible oils and add on edible oil to edible oils to increase shelf life? That's more like creating shortening someone's health, which is why we are here on the advocacy campaign. Say no, this is not it. Even though you are making gains, you are also running loss when it comes to your health, because eventually the consumers that consume these unbranded, unfortified oils will spend more in the health facilities at the long run. Yeah, so they wouldn't know. They wouldn't know. So,
yeah, let me interject here. I know that there's so much to say, especially on this specific aspect. Someone is also asking, another person is asking the question similar to this, because you've answered how we're engaging consumers. Someone also asked, how are we engaging the producers and the source of this unlabeled edible oil? So can you also just within 1 minute or so, 2 minutes, just quickly respond to that?
All right, very lovely. We've actually had that done across these 3 states. We've had producers come around and we had more like a tete-a-tete discussion with them to know, of course, the production process. And some of the things that we heard are exactly what I just mentioned earlier to you from the producers. Basically, they are for profit. The producers are for profit. And we have to create a platform with them to know how will this be a win-win. You can't continue to produce what is killing people. Meanwhile, some of these workers who are not part of the top management of these production companies do not even know the effect of what they are selling. All they just want to do is to market what they sell, get their pay, whether it's wages or salaries, and they go. So we've had a kind of discuss with them, more like a platform, a dialogue. Yes, that's the word. A dialogue with them. And in all of the states, it has been a productive discussion. And they've given us some head along that some of these things will change going back on, and which we hope to follow up with them, even as advocates on the TPRAC project.
Great.
Yeah.
Thank you very much. Thank you very much, Kunle. All right. So there's a question from Clarkson Wisdom for you, Adetola. And this is the question. Given the challenges of large-scale food fortification, how does the program plan to ensure equitable access to fortified edible oils across urban and rural areas while maintaining compliance with quality standards and engaging local producers effectively? So this person is talking about equitable access, between the urban and rural areas. So can you speak to that?
All right, thank you. And I think most of our discussions here had actually addressed that, because this is part of the aim of the third-party advocacy campaign, to ensure that the oil that is being produced, irrespective of the area, urban or rural, they are actually fortified according to standards, right? And they're actually safe for consumption. And part of those efforts, which had actually been highlighted, it's looking at it from different stakeholders, looking at it from the government's angle, which is around enabling environments, the policies and all, right? And when you look also at the producers, I would also like to mention at this point that while trying to look at how to bulk edible oil, we're also working around creating innovative packaging solutions, because some of those people, they want to do it. They just don't know how to do it, or they feel that what is being done currently is something that they cannot afford. So currently working on how to have what innovative packaging and also affordable packaging solutions could be, and still ensuring that the fortification there, it's not being compromised, and we are having safe foods that are being consumed by the population. So that is part of the work that we are doing currently on that.
All right. Thank you, Adetola. So there's a question that has popped up. I think about 2 or 3 people have asked the same question. And because of your background in nutrition, I'd like you to answer this. So someone is asking about the use of locally produced groundnut oil. How can they determine if the oil is fortified? And what guarantees do they have that this product is safe? Someone also asked something similar. Those who use local groundnut oil, what can they do to make it fortified locally? So can you speak to that?
Okay, yeah, so I think I'll start with the first part to say, how do you know if it is, how do you guarantee that it is fortified? As a consumer or as a lay person, you can't guarantee that. There is a process of analysis that is being done that to ensure that the quantity of the fortificants there is according to standard. You don't have the equipment or tools to do that. Right? And this is actually the responsibility. The regulation.
I think you're muted. I think you muted your microphone. I can't hear you. Can the other panelist hear Adetola?
No, I think she...
Can you speak, Adetola?
Hello, can you hear me?
Yes, we can hear you. Yes.
Okay, great. So I will just go back. Yeah, so I was saying that can you still hear me? Sorry, I could see them.
Yes, I can hear you.
Great. Yeah, I was saying that as a lame person, you can't typically do the analysis to check if your oil is actually fortified or not, right? Because there is a process that it goes through for the analysis that is being done. You don't have the tools to do that. But then this is the work of the regulatory agencies. They work to actually do the monitoring of the compliance. Like I mentioned at the beginning, to say they go to the factory, they go to the market. They actually check if the oil you are taking that is being produced is actually according to the compliance level. Now, there is also the responsibility of the producer, because it is your responsibility that the oil that you're actually producing is actually according to the standards that have been set by the government. So the responsibility is there around knowing if it's fortified, right? And I had mentioned earlier that for your edible oil, the easiest thing you could do is to check for the fortification logo. So at that point, you know that it is actually fortified. It is claiming to be fortified, right? Okay. How it's safe for consumption, if it's safe for consumption, I would typically just say that go for the branded products, right? By the time you go for the branded products, because of the levels of checks and monitoring that government does with these producers, is to make sure that the food that is coming out for you is safe for consumption. So it's typically just to say go more for the branded products. Well, about locally produced foods fortification, like I mentioned at the beginning, large scale food fortification is at the point of processing. So when it is not processed on a large scale pad, we don't talk about large scale food fortification. You could talk about home fortification now generally for other things when it is just done within, right? But then I could also say that there is other ways that people do, and I think some other countries are also doing into that. For people that do the local production, they could have a particular, like a bigger meal where they take their food products to. They take it there for the milling. When they have that local mill that does the milling. So at the point of the local milling, the fortification is done at that point. So it's like having a group production, and then fortification is done at that particular point. That is something else entirely. But I mean, for large scale food fortification, it's not what you do by yourself in your home.
All right. Thank you very much. Just a quick one to Dominic. I mean, someone is asking eHealth Africa, and saying, can we have, data charts, because I think because you spoke about data, so do people have access to the dashboard? Are they able to access it currently? Can you speak to that briefly, just within a minute or two?
Yeah, so the dashboard is open, is open to the public. It's something we can share, so users can have access to this data. And just to bear in mind, in case we are on the dashboard, these are data from previous years, from the National Food Consumption Survey that was plugged into a dashboard. So just to help us see like the chat the person asking the question is asking about. Thank you.
All right. Thank you very much. We have so much questions and so little time. Okay, so I have this one from Kunle. But Kunle, you have to answer it in like 1 minute or so. I don't know what magic you would someone. So this person is asking, says, Mr. Kunle, you talked about CBOs in your speech. However, CBOs are the least used in such awareness. Do you think the message has reached the people? So I think this person is just generally asking that how can CBOs be engaged more to further increase their awareness around this subject matter?
Yeah, thank you so much. Definitely, we can't say all the CBOs in Nigeria are aware of this, but we are actively engaging the CBOs, the FBOs, and the CSOs generally on this to help us spread the news. I know the virus as a tagline years ago. So we are still constantly working to ensure that it goes across every CSOs and CBOs, which is one of the reasons why the Insights Public Health webinar series is on. So I can know about it and go out there and spread that same news. Yeah, thank you.
All right. Thank you so much. You have done magic. All right. So I have another quick question for Adetola. So someone is asking, Idris Habib from Ilorin. So Idris is saying, as much as I agree that our edible food needs fortification, how do we know the limit? As most of these nutrients are micronutrients, and excessive intake can adversely affect human health. So can you speak to that from your expertise?
Okay, thank you. I'll try to deliver it in 1 minute. Okay, yeah. So for large scale food fortification, there is a rigorous process that all of these actually goes through. And the process starts from the point of setting standards. Standards are not just set by just plugging in numbers. It goes through a lot of data, trying to check what is the data, what is the internationally acceptable limits for this, then bringing it to what is the situation within our country. And it's not just done by the regulatory agencies, specifically the Standards Organization of Nigeria. It goes through even a level of stakeholder consultation. This is to be sure that the data that we are having is actually accurate, and it is actually for public good itself. So by the time the standards are being set for fortification, they are set according to the situation of the country, and to ensure that you have what is needed for you. And also to say that even from surveys, we could typically see what the issue of micronutrients still looks like in Nigeria. Not even just in Nigeria, basically. So I'll say that the issue of excess intake is not the challenge, even right now. And this is also part of the reasons why the surveys are being done. Surveys are being done on a regular basis to ensure that, to actually see what is actually the status even currently. And these standards are not just set there and you just feel like it just works completely like that. They are also reviewed based on the available data. Just this is to allay our fears and say that currently we don't have any issue of excessive intake, and the process actually takes into account every available data to ensure the safety.
Okay. All right. Thank you very much, Adetola. So I'm just going to take one more question from the audience. So there's a question, I can see two people asking the same question, and I think it's important. We've spoken about a lot of things, but we've not spoken about monitoring and evaluation. And so how will monitoring and quality assurance be implemented across the supply chain to prevent, counterfeit branding? Someone is also asking about the present monitoring strategies that exist, and compliance within the system. What systems are in place? So can you just quickly speak to that?
Okay, yeah, thank you. So the monitoring and compliance strategy, okay, I think I'll just speak a bit more to that. So for fortification, basically, we have the mandatory food fortification policy, which has been set. Now, the regulatory agencies from the Standards Organization of Nigeria, they actually go to the factories to do those checks in the factories. So the check for fortification data also at the factory, to ensure that right from the premix that is being used, even to your product that is being produced in the factory, they ensure that it is according to what has been set by the government. Now, when your product even gets to the market, NAFDAC does the assessment even at the market level to be sure that what we're having is actually products that are actually complying to the standards that we have. And then even FCCPC also does checks even at the consumer level too. So this is to say that from the different end to end, there is the system of monitoring that has been set and has been put in place. And this efforts has to ensure that there is consistency in doing this and to show most of this work that has been done. And to say also that when it comes to unbranded pork edible oil, there is an hidden gap around the side that could also frustrate the compliance checks. Thank you.
Thank you, Adetola. I'm sorry that, it's like we put you on a lot of pressure.
It's fine.
Got some time. Dominic, we're running out of time now. Dominic, quickly.
So just to add to Tola's comment, so on the project, we're able to even identify, yes, there are some level of compliance and monitoring, but then it's a bit uneven between these states. So you find some states even about, let's say, compliance of about 50%, while data is also showing some states as low as maybe 30 to 35%. But so far, generally in Nigeria, I think the surveys have shown that there's an improvement. As at 2018, compliance and monitoring was at about maybe 25%, and now we're approaching over 40% compliance. That's at the state level now. So compliance are in place, and I think it's just to continue advocacy and even engaging with these regulators to improve on those numbers. Thank you.
All right, thank you very much. I know that we can't, end this conversation without talking about what are the next steps, especially for government, for policymakers, for the private sector. So I just want us in 1 minute, Kunle first, what are the next steps and recommendations so that we can close out with that? And then Adetola, you share your recommendations, next steps, Dominic, and close out. So Kunle, over to you.
All right. Thank you so much. For the government, we just want to create the government, starting from where Adetola and Dominic stopped. When it comes to compliance, we need the regulatory bodies to help us engage in active and continuous monitoring of these market products, sincerely speaking. And that's why continued advocacy will still be needed, even from our hand to the government. So we need the government to help us do that. And to add it to, I want to permit me to also speak to the consumers, honestly. Adetola mentioned something about fortification, talking about essential nutrients. That means if they are essential, they are of essence. And if they are of essence, it will only make sense to demand for it. And that's it. If they are essential and they are of essence, it will make sense to demand for it. So from a consumer point of view, please help us demand for this so that even the producers can also succumb to your request. They are demand, they are the supply, basically. And I would say that since we are here on the platform, we can join us as other advocates, extension of this webinar series to advocate more for the promotion of this, of landscape fortification, and also the phasing out of this unbranded edible oil. Thank you.
Thank you very much, Kunle. All right, Adetola, over to you.
Yeah, thank you. I'll say that a lot has been done. A lot has been done, and definitely there is still a whole lot more to be done. And this is just to every relevant stakeholder. We need to do more in what we are doing. Basically, if we are doing it well before, the data is showing that more needs to be done. We need to think of even creative and innovative ways to do our work to make sure that we are able to deliver quality to everyone. And also to say that even for producers, we also have a responsibility here to ensure that the products you're putting out is actually safe for consumption and it is adequately fortified according to how it has been stipulated by the government. So that's it from my side.
All right, thank you very much, Adetola. And finally, Dominic.
Yeah, so my final words or even recommendation, one, to the government, based on our engagement even at the state level, there's a need for government to intensify or even give incentive for companies who are currently even complying. This is also to help them upscale production of this fortified oil. Also, this project tries to look at even policy. There's a need for government even to incorporate fortification on broader nutrition and food security policy. For the organized private sector, producers of this oil, there's a need for us to understand as producers that compliance is not a body, is our contribution even to national health. For civil society, the media, I would say let's keep amplifying consumer awareness. If we build consumer demand, and the population understand the need for unbranded oil, then the market dynamics will also change. Thank you, and over.
Thank you very much, Mr. Dominic. Thank you, everyone, for following this conversation. We know, yes, it's a short time, so many questions, so many things to say and to do. But we ask that you can follow us on social media and keep track of our work. eHealth Africa, GAIN, Nigeria, CSON, follow us on LinkedIn. And I'm hoping that we can have another, another edition of this conversation because there is just so much to talk about. However, we are grateful to our panelists for joining us, for giving us a part of their time. Thank you to the members of the audience, for those following live on LinkedIn and those on this Zoom call, for staying and being a part of this insightful webinar. Thank you so much. Don't forget to, like I earlier said, follow us on social media. Help desk, you can just display our QR code, for our organizational profile and for our impact report. Thank you very much. We appreciate you. Have a wonderful rest of your day. And till the next Insight webinar. Bye.
Bye.
Thank you and bye.
Bye. Thank you.